This webinar will provide information on the history, purpose, process, and current status of the Child and Family Services Review here in New Jersey. The Child and Family Services Review is a review of a state, U.S. territory, or federal tribe's child welfare system to help them identify strengths in the system as well as areas that need improvement. The child welfare system is not just about child protective services. It also includes service providers, the foster care system, as well as the court system. The goal of the CFSR is to ensure that states, tribes, and territories are in conformity with federal child welfare requirements. It also helps determine what is actually happening to children and families as they engage in the child welfare services. And it also assists states, tribes, and territories in enhancing their capacity to help children and families achieve positive outcomes. The history of the CFSR began with an amendment to the Social Security Act in 1994, which authorized the Federal Department of Health and Human Services to review states' child and family service programs. The Children's Bureau, part of the Department of Health and Human Services under the Administration for Children and Families, was identified as the lead agency to administer this review. After several years of creating and planning the review process, the first round of the CFSR began in 2001. Given the scope of the work that is required, the CFSR takes several years to complete nationally. Therefore, Round 1 was completed between 2001 and 2004, and Round 2 was completed between 2007 and 2010. No state, tribe, or territory were found to be in conformity during the first two rounds. Round 3 of the CFSR began in 2015 and will be completed by the end of 2018. New Jersey completed Round 3 in July of 2017. The CFSR process has three main components which require collaboration between the federal government and a state, tribe, or territory child welfare agency staff and other relevant key stakeholders. The CFSR begins with a statewide assessment. This assessment uses data gathered on foster care and in-home service populations so that a state can evaluate their performance on the child and family outcomes and factors that they are being measured on. After the statewide assessment is completed, teams of federal and state reviewers conduct the on-site case review. The on-site case review is a week-long review and includes case reviews, interviews with children and families engaged in the child welfare system, as well as interviews with key stakeholders such as caseworkers, foster parents, service providers, as well as relevant court staff such as judges, attorneys for parents, children, and the Child Welfare Agency. When a state, tribe, or territory is not found to be in conformity of any federal requirement, they must then develop and implement an improvement plan of those program requirements. This is known as the Program Improvement Plan, or PIP. States must successfully complete their PIP within 2 years in order to avoid receiving federal financial penalties. The CFSR reviews child welfare systems using 36 different performance measurement items. These 36 items are divided into two areas. The first 18 items measure safety, permanency, and well-being outcomes for children and families. These outcomes look at how well the child welfare system is ensuring that children are protected from abuse and neglect, that they are safely maintained in their own homes whenever possible, and that when they have to be removed from their birth families, that they have stability in their living environments and maintain family relationships and connections, and that they achieve permanency, such as reunification with their birth families, or if they cannot be safely reunified, that they are living in a loving permanent home and achieving this in a timely manner. Finally, these outcomes look to measure whether child welfare systems ensure families have the ability to provide their children's needs through comprehensive assessments and services, and that children are receiving appropriate services to meet their educational, physical, and mental health needs. Round 3 saw some changes to the CFSR process, which included allowing states to determine their ability to conduct their own state review or the traditional review of the previous two rounds. New Jersey opted to complete a traditional review. This encompasses a review of 65 cases in a week, broken down by 25 cases where children remained in their own home and 40 cases where children lived in out-of-home care. 3 counties across the state were selected for the review. One federal requirement for site selection is that the largest metropolitan area served by the child welfare system must be one of the 3 required sites. Therefore, Essex was a required county. The other 2 counties were selected to show diversity across the state. Essex had 31 cases reviewed, and the remaining 34 cases were split between Warren and Monmouth counties. In addition to the 65 case reviews, there were a total of 21 focus group interviews with key stakeholders to help assess the New Jersey child welfare system. The remaining items look to measure how well certain factors of a child welfare system are functioning across the state. This includes how well the child welfare system captures data like demographic data or the location of children and the goals of the families. It also looks to see how the system, to include the courts, is periodically reviewing cases to ensure children and families have written case plans that outline provisions and services to achieve permanency, and that caregivers are notified of court hearings. It looks to see how the system evaluates quality improvement, how well the system trains staff to include foster and adoptive parents, and how well the system provides services that are accessible and individualized to the populations it serves. Finally, it looks to see how well the system consults and partners with other stakeholders and how well the system recruits, retains, and approves foster and adoptive families. New Jersey saw some significant achievements in this round. Some examples include that assessing children's safety as well as risk of maltreatment during the course of a Child Protective Service investigation was strong. When children had to be removed from their family of origin, New Jersey ensured that children maintained family connections and stability. New Jersey's child welfare system works with other stakeholders and system partners to ensure that families get the services they need. They ensure that if a child had any educational, physical, or mental health needs, that services were coordinated to meet these needs. New Jersey also has a strong commitment to improving the child welfare system by identifying, describing, and analyzing strengths and problems, and then testing, implementing, learning from, and revising solutions. Similar to states that have completed round 3 thus far, the New Jersey child welfare system did find areas it will need to improve on. For instance, while safety and risk assessment was strong upon initial introduction to children and families, there is work to be done with efforts to support planning and services based on the ongoing assessment of safety and risk of children. This practice requires strategic engagement and comprehensive assessment of needs, and then match the right services for parents, to include foster parents, and especially fathers who play an important role in children's lives. When children required out-of-home placement, New Jersey's child welfare system, to include the court system, struggled to finalize permanency plans for children in a timely manner. And there were vast differences in the way the child welfare system works with intact families versus families with children who are in placement. The CFSR results highlighted 3 areas for the New Jersey child welfare system to focus on. It needs to focus on improving in-home practice by strengthening safety and risk assessment to help inform and guide case planning with families. It needs to improve the quality of the child welfare case practice, particularly around engagement and assessment of parents, and improve the timeliness of permanency for children entering foster care in New Jersey. New Jersey will need to implement a program improvement plan to address these 3 focus areas by identifying goals as well as strategies with action steps to achieve those goals. PIPs are reviewed on a periodic basis by the federal government to determine if those strategies and action steps are working towards goal achievement. In order to develop a comprehensive PIP, the New Jersey Child Welfare System, in partnership with the Children's Bureau and other stakeholders, began to analyze all available data sources. This included an in-depth review and comparison of the CFSR results to other quantitative and qualitative data, such as information gathered from focus groups, to provide feedback on what is working and not working in the child welfare system. Once all relevant data is gathered and analyzed, Work groups within the child welfare system began to explore and finalize interventions that could effectively impact the areas that need to be improved. These interventions will require implementation steps as well as a way to measure the progress. The next steps for the New Jersey child welfare system is to finalize the strategies and implementation steps of the PIP, and as well as finalize a measurement plan of progress. Once the CFSR PIP is approved, it will then be monitored over a 2-year period to support the progress of better outcomes for children and families engaged with the New Jersey child welfare system. For more information on the CFSR or to see New Jersey's final CFSR report, you can visit the websites to the following agencies: the Children's Bureau, the Capacity Building Center for States or Courts, or the Department of Children and Families.